Disease trends in the aging population. Canadians are living longer and life expectancy has dramatically increased for both men and women. In 2013, the number of seniors aged 65 and over rose to an all-time high of 5.4 million. That's over 15% of the total population. By 2036, it's estimated that 25% of the population will be seniors. As can be seen by this graph created by the Government of Canada, the projected changes in population trends are moving towards more people aged 65 and over than children aged 0 to 14 years. The growth rate of seniors is 4 times the growth rate of the total population. Those 85 years and over are the fastest growing age group in Canada. They grew by 127% between 1993 and 2013. By 2056, the rate is estimated to increase to 200%. Centenarians are those 100 years and over. This population doubled between 2001 and 2013. Statistics Canada projects that there will be a 9-fold increase over the next 50 years due to the aging baby boomers combined with decreased mortality rates. There will be over 62,000 Canadians in this age group by 2056. Approximately 75% of Canadian seniors reported having one or more chronic conditions. About 24% have 3 or more chronic conditions, which is called multimorbidity or comorbidity. As this table from 2009 shows, comorbidities increase with age. Living with chronic conditions can weaken the immune system and increase susceptibility to infectious diseases. About 76% of Canadian seniors reported using at least one medication to manage chronic diseases and increase physiological function. It is estimated that about 50% of prescriptions are not taken properly by seniors. This will increase as the baby boomer generation ages and uses more medications. There are many common chronic diseases and conditions in seniors. According to Statistics Canada, these 8 chronic conditions are prevalent in more than 10% of the senior population. In 2006, the 3 main causes of death for all seniors were circulatory diseases, cancers, and respiratory diseases. 25% of Canadian seniors have a mental health issue. By 2041, seniors will have the highest rate of mental health illness in the country. Mood disorders are the most common, including depression, bipolar disorder, or mania. They are more common among seniors living in institutions. In 2011, 15% of Canadian seniors were living with cognitive impairment, including dementia. This is expected to double by 2031 since the risk of dementia doubles every 5 years after the age of 65. As can be seen by this graph, the prevalence of both Parkinson's and Alzheimer's disease is also supposed to double by 2031. Statistics Canada estimates that approximately 1 million Canadian seniors were considered frail. This leads to falls, of which 20 to 30% of seniors fall every year. Up to 25% of these falls lead to serious injuries. Canada could expect between 2.1 to 3.1 million falls among seniors in 2036. In 2006, approximately 39% of new cancer cases occurred in Canadians between the ages of 65 to 79 years and 17% of those 80 and over, the most common being prostate for males and breast for females, followed by lung and colon cancer. The aging population is expected to create an increase of about 40% in cancer cases by 2030. In 2009, 23% of seniors indicated that they had some form of heart disease. The most common causes of death due to circulatory diseases in 2006 were ischemic heart disease and cerebrovascular disease. By 2025, it is projected that the number of cardiovascular disease deaths will increase for women, but not for men, since women tend to live longer than men. The number of deaths due to ischemic heart disease is projected to decrease, but for cerebrovascular disease is expected to increase. Arthritis was identified as one of the more common chronic conditions affecting 44% of seniors in 2009, with osteoporosis being the most common type affecting 85%. With the increasing aging population, by 2041, the annual cost of hip fractures alone is projected to increase healthcare costs by 26%. Chronic obstructive pulmonary disease, or COPD, influenza, and pneumonia were the most common causes of death due to respiratory diseases among Canadian seniors in 2006. In 2010, lung cancer, asthma, and COPD used 6% of Canada's annual healthcare costs. If no changes are made, the annual economic burden is projected to double by 2030. In 2006, 21% of Canadian seniors had diabetes. From 2010 to 2020, there will be a 57% net increase in diabetes prevalence due to the aging population, rising incidence, and falling mortality rates. Age-related macular degeneration, or AMD, is a degenerative disease leading to blindness. It is estimated to affect 19% of Canadian seniors aged 65 to 74 years and 37% of those 75 years and older. By 2031, these numbers are projected to at least double. Evidently, there are many chronic conditions with increasing prevalence rates due to the aging population. This is especially problematic when they become comorbidities.